3:30 p.m. on Friday, April 24th, 2020. Thank you for joining us. I'm Janet Hill with the Rock Island County Health Department. Today we have Nita Ludwig, the Administrator at Rock Island County Health Department, and Ed Rivers, the Director of the Scott County Health Department. Nita will give some prepared statements based upon new information coming out from the state today. Then both Nita and Ed will answer your questions to the best of their abilities. We ask you to direct your questions to the person you want to answer from in the chat box. And as always, the question and answer section will be moderated by Brooke Barnes of the Rock Island County Health Department. Nita, please start us off with Rock Island County's numbers. Thank you.
So today we have 16 new reported cases of COVID-19. One of those new cases is hospitalized. The others are all isolating at home. That brings our total cases to date to 336. There are currently 25 individuals hospitalized at this time in Rock Island County.
In Scott County, 8 additional cases were announced for a total of 196. And sadly, there was another death announced of a Scott County resident. The resident was an older adult, aged 61 to 80. I would like to express my sincere sympathy to the family and the friends of this resident. While we recognize the severity of COVID-19 illness in our community, it still stops us all when we lose a member of our community. Please keep the families of those we have lost due to COVID-19 in your thoughts. And I don't have additional remarks today.
Okay, go ahead, Nita. We'll go back to you for some of your additional information coming from the state.
Thank you. So on Thursday, Governor J.B. Pritzker said that all residents of Illinois should wear a face covering when leaving home. Starting May 1st, the face coverings will be a requirement in public for anyone age 2 and older and medically able to wear them. He also extended the Illinois stay-at-home order until May 30th. We support the governor's mandates and reiterate that the most effective ways to prevent further spread of COVID-19 remain social distancing by staying at home as much as possible, keeping at least 6 feet between you and anyone else, washing your hands frequently with soap and water for at least 20 seconds each time, and using hand sanitizer when hand washing isn't possible. Covering your coughs and sneezes with a tissue or into your elbow, and wearing a face covering when you must go out for those essential supplies, and staying home when you're ill. Those who have no close contacts that are infected with COVID-19 don't need to wear a mask while at home. Provided you do so alone or with close household contacts, other situations that don't require a mask or face covering include running or walking in your neighborhood, working in the yard, washing your car in the driveway, and other outdoor activities on your own property. As we have said throughout this pandemic, Illinois and Iowa might differ on some mandates and rules. Iowans aren't required to wear a face covering in public, but we believe wearing one will keep the infection rate of the entire Quad Cities as low as possible. We know that this virus spreads through respiratory droplets. Wearing the face covering in public reduces the number of droplets in the air. Face coverings protect all of us. Surgical masks and N95 respirators must still be saved for the healthcare workers and first responders. We all must do our part to keep them safe as possible while they are saving lives. When making or buying face coverings, keep these guidelines in mind. Use materials that will hold up to daily washing and drying. Launder them before you wear them for the first time. Have more than one covering per person so that they can be laundered daily. Wash your hands with soap and water and use hand sanitizer before putting on a covering and immediately after removing one. Avoid touching the face covering while using it. If you do, wash your hands immediately or use hand sanitizer. Have the covering fit snugly around your mouth and nose, and replace your covering when it gets damp or wet. And we also have some updated guidance on testing in Illinois. Because more testing is becoming available, the Illinois Department of Public Health has changed the guidelines of who can be tested. The bottom line is anyone with COVID-19-like illness or symptoms can get a test. As testing capacity expands, testing is now available for people who have COVID-19 symptoms, cough, shortness of breath, and fever, and have a high risk factor, such as contact with a confirmed case of COVID-19, or if they have a compromised immune system, such as a serious chronic medical condition. Testing is also available for those without symptoms who meet these criteria. If they work in a healthcare facility, or if they work in a correctional facility, such as a jail or a prison, if they serve as a first responder, such as a paramedic, emergency medical technician, law enforcement, or a firefighter, or if they support critical infrastructure, such as workers in grocery stores, pharmacies, restaurants, gas stations, public utilities, factories, childcare, and sanitation. A list of testing sites can be found online at coronavirus.illinois.gov/s/testing sites, and we'll put that in the chat box too for you. In Rock Island County, testing is available at Community Healthcare in Rock Island, Moline, East Moline, and Genesis Healthplex in Moline, and Unity Point Clinic Express Care, South Park Point, Moline. At each site, you must call ahead. Thank you.
Thank you very much, Ed and Nita. Well, you will now go to the questions. Please type in that you have into the chat function. We did receive a couple of questions ahead of time, so we will go through those now and then go to those that have been posted in the chat. The first question is for both Ed and Nita. We'll start with Ed. Are they going to release how many tests have been done in both counties? Ed?
Well, all the information available, including the number of tests done in Iowa, is available at the coronavirus.iowa.gov website.
Okay. Nita, would you like to respond to that as well for Rock Island County?
So for Rock Island County, I think we stated before that a long time ago, those numbers weren't going to be completely accurate because of the private labs doing testing versus the Illinois Department of Public Health lab. But the state does have a statewide number tested on their website, but I do not have a breakdown for Rock Island County alone.
Thank you. Second question, the Iowa Department of Public Health is reporting a death in Scott County. Is that accurate, or is IDPH behind on reporting deaths? Ed, can you respond to this?
We did note at the top of the hour that an additional death in Scott County had been announced today.
And so the four that the State Health Department has on their website reflects the number that we have here in Scott County?
Yes.
Okay, thank you. Next question, this is for you, Nita. Just to clarify the Illinois requirement for masks, do you have to wear a mask indoors at all times or just in places where 6 feet separation isn't possible? Perhaps you could just summarize that according to your earlier statement that you provided.
Sure, that was really, you do not have to wear one indoors at all times, especially if there are no ill people in your household. You don't need to do that. I think it was more on the statement of if there is a sick person in your household, then it is wise to wear a mask when anywhere time you're around that person.
This is for Ed. What are your concerns in Iowa opening earlier than neighboring states, attracting people from out of state who could spread the virus?
Well, they would be the same that we discussed in our call yesterday, that we need to continue to use social distancing as our defense against this virus. Warmer weather coming, people being outside more, businesses perhaps opening. This may give a false sense of security to people that they don't need to pay as much attention to staying at home as much as possible, making essential trips only, and maintaining that 6-foot distance between yourself and others. But that's not the case. We need to continue to do that as businesses begin to open and other services are allowed to restart.
Nita, the next question is for you. Could you perhaps comment on the number of cases in Rock Island County compared to other Illinois counties?
Sure. Well, I would say our numbers are rising, and we've been kind of talking about that as the daily press meetings go on. But I would say if you look at the state in general and the map on the Illinois Department of Public Health website, you'll see the counties that border another state like we do here tend to have some of the higher numbers. I guess that's all I can say right now.
Thank you. We do have another question for you, Nita, regarding the mask directives you were providing. What is your advice to parents with children 2 and older whose children refuse to wear a mask per the Illinois May 1 directive? What should they do?
Well, that's a challenge for all parents out there, I'm well aware. But I think as a parent, you just have to kind of communicate the best you can with children and let them know that, now there is, a germ out there that we do not want the kids to get infected with, and this is the best way to keep safe.
Thank you. Next question, this would be for Ed, since it's related to Iowa. Are we going to encourage residents to go to testiowa.com and submit their questionnaire?
Well, the governor has announced testiowa.com and the availability of the website and encouraged all Iowans to go to the website and enter their information and determine whether they're eligible for a test. I believe the first day that it was out, over 80,000 Iowans completed it. Haven't heard a recent number. We don't have much information on where and when tests will be available in Region 5, which is the region that Scott County is in. That undoubtedly will be coming out later, but that website is available to you at testiowa.com.
Thank you. This would be a question for both Ed and Nita. Do we know how many people that have contracted the coronavirus had a flu shot this year? Nita?
No, we don't have that information. When we are talking to positive COVID-19 patients, that is not one of the questions that is asked as a COVID-19 person under investigation.
Ed, do you have anything to add to that?
I haven't seen any source that provided information on that, but it's a statistic that wouldn't give much information because the flu shot is not protective against COVID-19.
Thank you. For both Ed and Nita, we can start with Ed on this one. Any news about antibody testing?
I did note in the press that LabCorp, which has facilities in this area, is ramping up their nationwide antibody testing. But as far as specific testing for the general population, I haven't seen any indication that that is going to be happening anytime soon.
Anything to add to that, Nita?
I would just say that the governor of Illinois this afternoon just said the state is not concentrating on the antibody testing until they can get some good, reliable tests. They are working very hard to expand testing for COVID itself.
Thank you. Any progress on receiving more accurate demographic information for the 2 counties? Ed?
As we've said, the Iowa Department of Public Health is the entity that puts out the information, and all the information that is available in the state of Iowa and 4 counties is available at coronavirus.iowa.gov.
Nita, for Rock Island County?
I think the same would be true of the state of Illinois. I know Dr. Zike today spoke a little bit about they are still trying to get more data and be able to share different breakdowns of demographics. So when that's available, we will share as much as we can.
Okay, please type any last questions in to the chat box and we will go over them now, or we will begin concluding the call. Okay, thank you to everyone for joining the call. We look forward to talking with you next week. Have a nice weekend.